Hello, everyone, and welcome to the Austin LGBT Chamber of Commerce Health and Wellness Committee webinar. We are so excited to hear from some of our members, but first, let us introduce ourselves. I am Colton Asherbanner, Marketing and Communications Manager at the Austin LGBT Chamber, and I'm joined here with Health and Wellness Committee co-chairs.
And hi, I'm Dr. Antoinette Moore. I'm a family medicine doctor, and I'm really happy to be serving on the board. I have a huge interest in all things health and wellness with my family medicine training. I'm currently working in urgent care. May you never need my services, but in case you do, most days of the week I'm at Care Now Urgent Care, St. David's Care Now Urgent Care at 290 and South Congress. So I'm really thrilled to be working with all of you. And part of the reason why we wanted to do a webinar like this was just give everybody a chance to get to know each other, because it's not so easy for everyone to make it to happy hours and things like that. And I think that a lot of our members have a lot that they can offer across all of their specialties. So I'm really hoping that this is a great springboard for people to figure out, hey, I actually have a need and you can help me with that, and let's all kind of build more community. I'm gonna go ahead and hand it off to Maddie, who I have right here, my co-chair on the Wellness Committee.
Hi everyone, thank you all so much for being here. My name is Maddie Newlands. I am the Community Outreach Coordinator for Ellie Medical Emergency Room, specifically our central location, which is off of Burnett Road in 2222. We're excited to be here and get started to learn about everyone here. So I think we're gonna do a little quick intro for everybody, a little hello, hi, my name is kind of thing.
And I can't see everyone on the screen, so if you'll just unmute and introduce yourself and then mute yourself again, that would be great.
How about
nobody likes to go first? Oh,
Yes.
Somebody would like to go first. Oh my gosh. I'm Tina Cannon, President and CEO of the Chamber. I'm gonna shut up now. Bye.
Hey everyone, Brandon Willerson. I am the Senior Director for Philanthropy and Community Engagement at Vivent Health, and I look forward to talking with you a little bit later. Maybe I'll pass it to Jessica.
Okay, thank you. My name is Jessica Best. I'm an emergency medicine physician at Ellie Medical Emergency Room, and I'm the medical director at our central location where Maddie works. And I will pass it to, it says Sid on the screen.
Hey y'all, I'm Sid. I am a physical therapist and the owner of OutWellness. Oh, I can't see anybody else on my screen other than who just talked.
I'll go next.
Sorry.
I'm Christine Alexandria Solomon. I am a foundational nutritionist with Life Healing Nutrition.
I'll go. My name is Eva Greenwell. I'm a clinical director at Ellie Mental Health.
Hi, everyone. I'm Allison Smith, the owner and founder of Our Lives Counseling.
Right. Anybody else want to say hello before we keep moving on? All right. Thank you again for sharing your lunch hour on a Monday with us. That usually can be kind of hectic for most. I don't see our representative from St. David's popping on just yet. So if it's okay with everyone, let's go ahead and move on to Sid. So you just introduced yourself, Sid. You're the owner at OutWellness. You and I had a really awesome sit-down conversation recently where I got to learn a lot about what you do. I'm gonna let you talk because I think that you're fabulous about talking about your business, and I might pepper you with questions here and there, but tell us about OutWellness, which I think you have a lot to say about
Yeah, I do. I'm trying to figure out the view where like I can see people, but I can't see anybody, so I'll just talk. Yeah, I'm the owner of OutWellness. We are I'm queer, but we are a queer health and wellness center, dedicated to creating safe spaces for marginalized folks, specifically queer and trans folks. So, as the legislation has gotten more and more restrictive and oppressive to our trans chosen family and community, we've really upped the ante in our wanting to serve that community. So we do weekly no cost trans femme and trans mask workouts. I do a lot of pre and post op gender affirming care, gender affirming surgeries. I partner with a lot of people who are doing similar things, but also more generally just trying to create a safe space for folks who don't feel comfortable in a general health and wellness setting. Antoinette can attest, when you walk in, it looks a little bit just like a normal gym. Like you walk in and there's like a waiting room and then it's just a gym. And so we have options for folks to come in and work out. We offer massage and acupuncture, physical therapy, personal training. We create a holistic approach for everybody who comes in, and just try to give people who may have had bad experiences in the health and wellness industry at large, an opportunity to have a better experience.
Yeah, I think that's a great intro. I'm going to pepper you a little bit more about some of your goals for the future too, because you've got some big plans.
Yeah, I do. We just moved into this bigger space. So we started for the first 3 years out of my garage gym. We moved on June 17th into 1,900 square feet. So we did that, and thank you, whoever clapped. That's cool. But so like at first I was like, oh, this is my goal, like I've done it. And then as soon as we moved in, I was like, no, like we're gonna do more. So yeah, I mean, my real true dream overall goal is to have a huge health and wellness center that encompasses every part of health and wellness, whether that's physicians, chiropractor, PT, massage, some of the things we offer, some of the things we don't yet, in one space where everybody can come in and see somebody that looks like them in terms of race, gender, physical ability, neurodivergence, anywhere along any of the spectrums where people don't fit into the quote unquote norm. They can come into this space and know that their provider is going to be affirming, and they're not going to have to deal with a lot of the, I'll just call it stuff, that people deal with in the general health and wellness world.
Yeah, like you and I talked about how you're really building a lot of community, and I love that you even have, do you even call it the banned book library? I couldn't remember, but you have your little library there that you can read. It's all the books are everything from health, wellness, nutrition to just queer culture, and I thought that was really impressive too. Like you mentioned some of the things outside of workouts, right? Not just the sweat part, but the other things that you guys are up to at OutWellness in terms of building that community. Can you talk a little bit about that? It's a little unusual for a physical therapy space, right?
Yeah, I'd say so. Yeah. Yeah, I mean, really like our whole business is created on community, and that's the center point of what we do. And I talk about it all the time. So we have our banned book library. It was so cool. I literally just posted a story and I was like, I want to do this. And then the next day at the space, there were like 30 books there just waiting for me at the door. And like, that's how it started, was just like me being like, I want to do this. And then like somebody just donating all of these books. So we do things like book club, we're doing open mic, karaoke. We just had a partner massage workshop. We're trying to just incorporate all of these things that people might need. We find that a lot of information in the health and wellness world is gate kept and by a pretty hefty price tag. And I want people to come to me because I'm very good at what I do, not because they can't find the information elsewhere. And so I really want to talk about, I couldn't read that. But anyways, yeah. So yeah, I just want to try to get as much information out there as I can. And stop gatekeeping the information. And then if people want to seek out care beyond that, then that's great. But I want them to have kind of a starting point.
Yeah. Tell me about this certification course for healthcare workers that you're interested in making. You put that on your questionnaire.
Yeah, I love it. Thank you. Yeah. So I'm working with someone really similar to Antoinette. Actually, I just didn't know that you existed until recently. But a physician who has her residency in gender affirming care. And we're creating, and I'm working with Texas State as well, and we're creating a continuing education course for healthcare workers to be more competent in treating queer and specifically trans people. And this starts really basic. It starts with language and pronouns and definitions of like what the LGBTQIA stands for and very basic things. And then it gets into more healthcare specific things like surgeries that they might have, how would that affect care? Hormones that they might be on, how would that affect care? And trying to tie that all together so that when somebody sees a trans person or a queer person, whether it's for the gender affirming care thing or something completely different, they understand how to interact with that person, and hopefully makes queer and trans people feel a little bit more comfortable in the health and wellness world, where we know right now they are just completely not, especially in a place like Texas. So that's the goal.
Yeah, I think that's awesome, because a lot of people need that information, and it starts at the front desk. It starts at intake forms. It starts well before you ever meet your provider, whether or not somebody can feel safe in a space. So.
And a lot of times the provider is the person who spends the least amount of time with the person, especially if you're in an insurance-based world. And so it's almost more important that these support staff have the correct training because they're interacting with the client far more.
Yeah, that's a really good point. I love that you're also looking to connect with more providers of different types of care. So I think that, anyone on this call who's interested in partnering with Sid, if you want Sid's contact, reach out to us, or, there'll be time for questions at the end, but think of this as an opportunity to network, because I think Sid has a lot of big plans, and I think it's really awesome.
I do. And please connect with me. I love meeting new people, but I love people who are passionate about this community like I am. So if y'all want to connect, I would be really, really happy to.
Yeah. And then, so Sid, your brick and mortar is in South Austin, just off of South Congress, by St. Ed's.
Yeah, right next to St. Ed's. If y'all are familiar, it's right across South Congress from Cosmic Coffee. That usually is a pretty good location for folks to know. So yeah, that's where we are.
Awesome.
Yeah.
Is there anything that you haven't talked about that you want to make sure that we talk about?
Your questions were spot on. I think that's literally everything I'm doing. Also, if you have ideas about things that you want to do to support the community that you think I could be a part of, I'm always looking for things to hop in on and help out with too. So if you're like, ooh, this sparked something, I wonder if they'd be interested. The answer is always yes. So just generally.
Yeah. And for everyone on this call too, when I met with Sid, they expressed interest in being a part of our wellness committee also in a more formal way. And so we're happy to welcome them. If anyone else on this call wants to also join the wellness committee, I see Eva's interested. Okay.
Come on.
So, in other words, I think more voices are always welcome, so that we can find out what types of events and networking opportunities will be the most useful for you all.
Yeah, for sure. Thanks for having me be part of the committee. I'm excited.
Yeah, we're very happy to have you. So why don't I go ahead and let you take a breather? And I see Christine is on the call for Life Healing Nutrition. Christine, I think you're muted. Are you there?
Okay, I think so. You can hear me?
Yes, thank you. We can't see you, but I don't know if that's, if you want to keep your camera off, please feel free to. So Christine is the owner of Life Healing Nutrition. So Christine is the owner of Life Healing Nutrition. They are a foundational nutritionist, and have been in the healthcare field for 40 years. I'm going to let Christine explain more of what a foundational nutritionist really means. So Christine, take it away. Oh, Christine, you're muted right now. Oh, there you go. No, Christine's microphone keeps showing off and on.
Okay, there we go. Me and technology. So yes, foundational nutritionist. So I'm going to tell a little quick story because this actually started over 40 years ago. When I was 19, my father passed away from cancer, and I watched him within 3 months go from
Oh no, Christine, I think we lost you again.
Okay, it unmute for some reason it keeps muting me. So anyway, so basically at that time when my father passed away, I was very, of course, angry. I was devastated, and I wanted to know why. My father was very healthy. He didn't smoke. I don't know why it's continuing to do that. Hopefully I can get my message across. But anyway, I learned through the years, I became a nutritionist. I started as personal trainer, so I learned a lot about physiology of the body and started delving into nutrition and alternative care because of that. I brought my children up on homeopathic remedies and herbs and supplements when needed. And I don't know. It's not, I guess my system, I'm sorry. But anyway, I did find that when I became a nutritionist, I started working with endocrinologists, cardiologists, psychologists, osteopaths, and chiropractors. And with all the people that I worked with, there was an underlying thread that was common. There were
Oh no.
certain basic needs of the body that needed to be met. So even though everybody is different, there's never any two people that are alike. There are certain basic needs. So I look at digestion, I look at immune health, especially with autoimmune conditions like HIV. I look at mental health as far as like neurotransmitters, adrenals for fatigue. So I look at all of the basics. Why I call myself a foundational nutritionist. So I work with like I said, I can do testing for all of these things. I also I treat supplements very lightly, as far as they're there to balance the person, to balance whatever is out of balance. And I know what questions to ask, so they can go to their doctors and not just be told, oh, you need to take this medication, or no, this you're really not, you're getting older, that's why you have fatigue, or you're this kind of a person, that's why you're that way, because that's not true. So I work with them to educate them, blood chemistry, like I said, testing if it's needed. Working especially with people who are transitioning hormonally. There are a lot that you can do to support that with supplements and also lifestyle changes. Sometimes it's very simple. And that's what I like to do, is make it simple and easy to understand, and also easy for them to incorporate into their lifestyle. There's also certain sap your body of certain nutrition aspects. And so helping to support people with that and understanding that just because you're given a certain medication, especially some of the preventive medications for HIV, those can actually slap your body. And so supporting the body with that. And that's basically what I do.
Okay. I think even with the audio cutting in and out, I think that we got a lot about what your mission is and what you offer. It sounds like you do a lot of, the theme that I'm getting is that you really tailor things to the person, which is, I think, what's going to be so important for people in their relationships with a nutritionist, because
Yes.
a lot of nutrition information is out there, and a lot of insurance companies offer nutritional services, but it might not really feel individualized. So it sounds like that's where you really can make things shine. Is there anything that you feel you haven't shared with us about your business? I guess a question I have for you is, do you do a lot of things via telehealth, or do you have people come in person? How do you like to see people?
Yes, I work remotely. My goal is, though, to start giving more classes, whether in person or via Zoom, because education really is my focus right now. And especially, like I said, having the people understand where they're at, to listen to their bodies. And so, yes, I've worked with people all across the country and even in other countries.
Okay, that's very cool. Is there anything about your business that we haven't talked about yet that you wanted to make sure that we give you the opportunity to talk about?
I think the main thing I want people to know is that I give
Oh my dear, you just dropped out right after the main thing.
I get the feeling of a safe place for people to come. Just like Sid was saying, it's so important for people to be seen for just who they are, for their uniqueness, for their creativity, just for how special that each person is, and to see them as that person and not judge or put any labels on them, and to see what they need as that individual and work with them to achieve that.
I think that's beautiful. For once, probably in all of your lives, I can say that we're running ahead on a meeting. So I wanted to give you all that update. We were going to have another member, but they were unable to attend. So I'm going to actually pass things back to Maddie.
Awesome, thank you so much. And we're gonna jump to Allied Medical. So I wanna introduce y'all to Dr. Best. Thanks for being here, Dr. Best, I appreciate it. If you wanna tell us a little bit more about Ally, where we're located, what we do, and just kind of an introduction of us.
Okay, yes, thank you. And thanks for having us. We are a physician-owned emergency room, freestanding, so not connected or affiliated to a larger hospital. The location that Maddie and I work at, or I mainly work at, I work at several of them, is on 2222 and Burnett Road. And we also have a location in South Austin, and we have a Dripping Springs, a Buda, a Round Rock, and then 2 in Houston. Am I missing any?
Bastrop.
Bastrop. Forgot Bastrop. And so you could consider our emergency room kind of almost like a concierge emergency room. We get people in very quickly, usually do no wait time. Unfortunately, because we are a freestanding emergency room, we cannot take Medicare, Medicaid, or TRICARE. So commercial insurance. And one of the unique things about our business is that we have pretty low cash pay options. So if you are uninsured, or even just some people that don't want to go to the hospital and wait several hours for whatever's going on, we have cash pay options. And so that's pretty neat for the community And we set those prices as the physician. So we can get you in and out quickly and hopefully for a bargain price. And we obviously treat all emergencies. So if you come in with an emergency, of course, you're going to be, treated appropriately, transfer out. And we usually can get you transferred out very quickly too, if needed. We have to get you to a higher level of care.
Awesome. And what inspired you to kind of move to a physician-owned emergency room compared to regular hospital ER?
Sure. So if any of you have been to a hospital ER, and I work at a separate one every now and then as well, you know how crazy it can be. Very long wait times. And when you have something that maybe isn't, you were shot or having a heart attack or whatnot, then you're going to have a very long wait time compared to some other individuals. So we're there to offer quicker care, in and out care, which I think is great for the community. We obviously have a growing population in Austin. So if you had hospitals alone, likely they wouldn't be sustainable in terms of helping out the community with emergency care, or the wait times would just be even longer because, as you know, they can be lengthy with just who they have right now. So I think the freestanding market pretty much helps ease that burden for the community.
Awesome. And then how does Ally kind of stand within this community of emergency care? I guess, how do we serve this community and strive to make a safe and welcoming space?
Yeah, so I would love to talk to Sid more about this because we would love to make a safe and welcoming space for everybody. And I think we do that. Of course, I feel like maybe you don't know what you don't know. I know we try to do our best to, when people come to the front door, make sure they're addressed appropriately, make sure the providers in the back, everybody knows, how the person would like to be addressed. Of course, it's a very private space. So HIPAA, everything, you have your own room. There's nobody that's going to hear everything else. And I think people try to do their best to really understand maybe some of the complexity to some of these patients and maybe the medications that they're on and things like that, and how they affect someone differently than just say maybe your status quo patient that you're like, oh, well, these are your risk factors, right? Because my textbook says that if you're male, it's this, this, and this, right? And if you're female, it's this, this, and this. So I think there's been a big push lately in the medical community to have a better understanding when there are differences and there are people on medications and things like that. So I think we're striving to get there, and I'd love to learn more about really training the staff or getting more information to the staff about how we could make our emergency rooms even more welcoming to people.
Awesome. Thanks, Dr. Best. Do you have anything else that you'd like to add about Ally?
Well, we'd love to be your go-to emergency room. We also work pretty closely with the Kind Clinic to help them out when they have overflow patients, after hours patients, weekends, especially holiday weekends, they kind of run into a bind. And so we're there. We're there for any business that really needs us, like the urgent cares, after hours. So yeah, we would like to make the connections in the community to, see patients as needed, and also send patients to you, because obviously a lot of our patients are going to need follow-up, whether it be cardiac care, orthopedic care, maybe physical therapy, maybe a nutritionist, whatever it is. We can always give resources if we have them for the patient.
Yeah, Dr. Best, I definitely send a lot of people from urgent care to you folks because
oh yeah, we do.
People try to come to us for things that really aren't urgent care appropriate. So I'm really glad that freestanding ERs that are reliable and have such high standards are in the community.
Well, thank you. Thank you for the patience.
Thanks, Dr. Best.
Thank
awesome.
you.
So we are going to move forward with Ellie mental health. We have Eva here with us. Are you still on? Yes.
I am.
All right, so do you want to just dive in and tell us a little bit about your business?
I will say Ellie is a franchise-owned business. My business, our location is owned by Cindy Matella, and I'm the clinical director here. A little bit about what we do. I would say a little history of me. I always say and kind of tell my age when I say this, but I've been in medical for 30 years and mental health for 24. First degree was a nurse. I have a bachelor's in nursing, and then I worked on a mental health unit in Illinois. Found that, man, I really loved it. Right, and then ran a couple hospitals. I've been director of Austin Oaks. Been a director of Georgetown, and then I seen where the follow-up care wasn't there. People get out of hospital after a crisis, and then they have no follow-up care. So then it was, okay, outpatient mental health. I have therapists. I have a nurse practitioner to assist with medication management. Right now, it's really hard to get into to see a psychiatrist. So we have a nurse practitioner here. So I have therapists, we do EMDR, we do, but if you were to call me on clients in crisis, I will get them in within the week with my therapist. And I hire more therapists as the need comes. It's a calm, safe place. So when someone can come in and not feel judged, that's what I love. All my therapists I personally hire, and I'm like, nope, I need to know that if anybody comes in with whatever, that you are going to be that calm, safe place and non-judgmental. What else would I want to say? We take insurance. So it's affordable mental health care. That's why I was like, yes, sign me up. Is that it's a copay. Today I got to tell a couple people that they've met their deductibles and it's not going to cost them a dime to see us because they've met their deductibles. But there is 11 of us now here, therapists, EMDR, trauma, individual. I do couples therapy. But it's a calm, safe place to come in and talk about whatever and not feel judged.
Can you tell everybody what EMDR is in case they don't know?
Oh, so it's called eye movement desensitization resensitization. Everybody knows it is the watch my fingers, right? But sometimes it's the tapping. I do the tapping. But when someone's been through a trauma, it's usually connects to a negative, which is a trigger, right? So it is us calming that trigger down. So I'm going to pick the last situation is where don't like somebody behind me because I always feel like I'm going to be attacked, right? So to be able to feel that I'm safe. We were able to take it to where she was able to feel like she could go into her room and be safe as long as she, knows her surroundings. But she was always at a place, she didn't want to leave the home because of fear of her safety. I have a gentleman that had a trauma event that was able to go back to the place that he was traumatized on vacation and spent two weeks and had another positive event happen, but he stopped. It's the triggers will be desensitized, and the memories are there, but we're taking away the negative condensation to that memory and not, like I always say, de-escalating it.
Interesting. I've never heard of that before.
It is. When I tell my age, I've been at it for 30 years. When I seen how fast, I have been with clients for years, and I seen how fast it took somebody from a trauma event to where they felt more confident in themselves. I'm like, sign me up. It's all about the patients here. And if I can help someone get it through a traumatic event and feel that they can go back into life and doing the things they enjoy, sign me up.
I think that's great. And the fact that you can get EMDR therapy that insurance can cover, that's very
Yes.
unusual.
Yeah, and again, this is where with Ellie, I love it. A lot of different private practice, they charge more, they do this, and I'm like, no, your session, your copay's met, sweetheart. It's zero today. You know, it's zero today. You're not, you've already paid your insurance. So that's why I chose to come to Ellie. Because again, I want mental health care for everybody. I want it to be out there. And what we do at Ellie, I advocate. I work with the Austin PD to try to help them understand people's reactions to behavior. You see anger when it's actually could be, I'm tired, I'm overwhelmed. I work in the communities with the schools, helping kids. A lot of times when it's the transition, you have to have therapy. Doctors require therapy. We have been like, come on in, we're going to get you scheduled, and we'll get you scheduled with a therapist really quick so that they can have that transition.
Awesome. And how do you see Ellie as an ally to this community?
Mental health. It's very judgmental. Families, friends, but it's a place to come in and talk and not feel judged. It's in the workplace, it's everywhere, right? And so this is a calm, safe place to come into. I have couples that, struggle with communication and literally have found trouble finding a therapist that will meet with the community. And I'm like, I don't understand why that should be a barrier, right? So I'm like, come on in and we'll work on your communication.
That's awesome. I love that. Is there anything else you want to add about Ellie?
That, again, that I love working with, I've said I'm all about come on in. The more my team knows, the better. Always say we can work with the physical, the mental, and be a calm, safe place. It sounds like for everybody.
Thank you so much for being here. We really appreciate it.
Yeah.
Thank you.
I could refer you people from urgent care. I think people don't realize how many times in urgent care I see people having panic attacks. And it's really hard to get them into mental health services.
Call me. I would say, because I used to be, I was the director of Austin Oaks and Georgetown. And anybody that came into the hospital, my team assessed you, determined the level of care, if you were going to be hospitalized, if you're not. And a lot of times it is, patients having a panic attack. And they're thinking, they're having a heart attack. And it's like, no, they don't know. And if I can give them skills to assist them, sometimes people think it's anxiety is like, this has been my life. And I'm like, no, let's make it to where when you feel that, it's uncommon, not that it's always there. So give them those skills.
I'm definitely going to send you people.
Send them.
All right, thank you so much. And we're going to move on to Vivent Health with Brandon. Thank you so much for being here. If you want to just jump right in and tell us a little bit about the company and what you do there, that kind of thing.
Excellent. Hey, everybody. Good to see everybody, especially those that I know were out at Pride this weekend. It's like, I don't know how we did it, but we did it. So yay us. Proud of us for always showing up. So Brandon Woolerson, my background, I'm a social worker. So I've been in Austin since 20 years now, which is hard to believe. Been primarily working in the HIV space. Have recently come over to Vivent Health. Vivent Health was formerly Aid Services of Austin. You may recognize that name. So we were founded as ASA in 1987, which means we're in our late 30s now. So we're approaching 40 in 2027. So expect a lot of celebration as we approach the 40th anniversary. We became Vivent Health in 2020 when we merged with Vivent Health, which was an organization based out of Milwaukee, Wisconsin, but really is a conglomeration of mid to large size HIV organizations in states mostly in the Midwest and Texas. So we are in 6 states, again, kind of mostly Midwest, and then Texas, wherever we are regionally. But Vivent provide services for folks living with or who are impacted by HIV. So we provide a comprehensive array of services on the HIV side through medical care, through our HIV medical home, which really puts the patient at the middle of their treatment and their care plan, and the services are really wrapped around them, from the medical care to the social support services needs, including housing, case management support, linkage to community referrals. We have a dental clinic, the Sansine Dental Clinic. We have our food pantry, which are meeting the nutritional needs of our community, which probably will be no surprise to this community, but the nutritional needs, the food needs of our community continues to increase. We've not slowed down since COVID. In fact, we've just continued to ramp up the need for food and nutrition assistance in our community. And on the at-risk side, of course, we've got services for folks who are needing HIV, STI testing and treatment. We have access to PrEP, pre-exposure prophylaxis. I would just like a quick shout out, since Dr. Best was on earlier. I used to work at the Kind Clinic, and would just like to say what a great partner that Ally has been for the community, and helping sort of brainstorm sort of community needs and resources. So even though I'm not with Kind anymore, I just would like to give a shout out to Ally, because it's such a great resource for the community. So for folks who don't know, we're right at 7,000 people that are living with diagnosed HIV in the Austin Travis County area. Those numbers continue to increase. The rate has decreased somewhat over time, but we're still 200 to 250 folks diagnosed each year with HIV. And obviously, as a community, we're here to try and meet those needs comprehensively through a network of care providers and organizations that really are designed to really meet the needs of our community. So understanding the other services that are that are more on the holistic side, that of course is necessary and needed for some patients as well. One thing that I would like to highlight, we do have I mentioned our food pantry. That's one of the main areas where we always need volunteers, because obviously it's a lot of work to run a food pantry, but it also gives you a direct connection to our patients and our clients, the needs that they face on an ongoing basis. Gives you a real personal connection. And so I'll put my email in the chat, because we're always looking for volunteers. We're also increasing our corporate engagement, trying to find ways to come either have corporations that have employee resource groups, have opportunities both to come to us and for us to come to them, for ways to engage those communities and really connect you all to the mission. Because while we obviously are a full service clinic and operation, we can't do it without the support of our volunteers. And so we really want you all to be, just as connected to our work. So would really encourage you all to reach out and engage. Be happy to host anyone on a tour, happy to host this committee at some point if that works in the future for a meeting on site. Because again, there's so much more to do, and there's so much more people we need to be connected to our work. And so, yeah, with that, I think, and there might be some other questions that the group has, but I guess I'll stop there.
Awesome, thank you so much. Could you possibly host a chamber-wide volunteer day at your pantry?
We will be happy to explore that. Our only challenge, we're somewhat limited with capacity and space, so we just have to figure out, shifts and number of people. And 100% we want to talk about it, because we need you all. We need each other. So absolutely, let's talk.
Awesome. Yeah, a volunteer day would be really cool.
Yeah.
Yeah.
Let's do it.
Oh, do your docs offer gender affirming care?
So I would say that is not a listed service that we offer at this time. But I would say we do have folks within our setting that could happily connect folks if the need exists. So I'll put the email in the chat again, and you guys can reach out. But for now, our services are for folks living with or at risk for HIV at the current time. but obviously we care greatly about the needs for our trans community as well.
Yeah, absolutely.
All right, did you want to add anything else, or that pretty much covered it?
No, I'm just grateful to be, reconnected with the chamber, getting to know you all. It's been a really great opportunity for me to grow my connection and again just get Vivent's name out in the community. So please reach out if there are ways for us to work together, to collaborate again, or to send some volunteers our way.
Love it. Thank you so much.
Yeah, absolutely. Thanks, guys.
Look at us being right on time.
I know. I do have a couple quick announcements before we get to questions. We will have 2024 dates for the holiday toy drive coming to you soon. If you would like to volunteer with us for the toy drive or serve as a drop-off location, please reach out. And then when we get to questions, we would also like to know webinar topics, future topic ideas that you have, or event ideas would be awesome as well. We will also love to see you on Thursday at our Austin Arts Mixer with KMFA Classical over at their radio station on the east side. We will have over 40 local LGBTQ arts nonprofits. And there will be food from Alfred's Catering, drinks from Tito's, Still Austin, and our friends at Best Little Wine and Books out in Lockhart. Should be a great time. You can scan this QR code to learn more. And let's open it up for questions. So if anyone has any questions, just unmute yourself and feel free to ask away.
I'll go.
Oh, go ahead.
Go ahead.
Go, Sid. Go. No, you started. Go.
I'm sorry, I can't see anybody on my screen, so I didn't see you. I'm sorry. Brandon, wherever you are.
Hi, I'm here.
Oh, were you the one that was just trying to talk?
Yeah, it's fine. Go. Tell me what you need.
So I actually had one of my really good friends works at Vivent, and I've been trying to get with him to do y'all do like mobile testing ever? Like, would y'all come to, I don't know, where I work, for example? Oh, I have everybody now.
See, now you can see us in living color.
Yeah, hi. Do y'all do any like mobile testing?
I'm so glad you asked. It's like what the things that I probably should have said. Yes, 100%. We have a mobile testing van. We're out in the community. We have walk-in testing hours, of course, throughout the week where you can walk in to our clinic. The clinic, I should have also said, we're just on the Lamar side of Highland Mall. So we're on Highland Mall Boulevard. So pretty conveniently located there at Airport Lamar. But yes, let's connect. I can connect you to our prevention team to talk about that. In fact, I think relatively recently our testing van was we provided some testing support for a chamber event, maybe in Lockhart, maybe in Taylor, one of those outskirt towns. And so of course we'd be happy to talk about ways to get our testing van out to your communities.
Awesome. Thanks, Brandon.
And we loved having you all out in Lockhart. So thank you for that.
Yes, Lockhart. Thank you. Sorry. One thing I was going to add, one of the things that kind of a long-standing volunteer group that has been connected to ASA at the time, and now of course Vivent, is the Octopus Club. And the Octopus Club, I would say in their heyday, we're operating for different types of events throughout the year. Obviously with evolving needs and challenges, we're down to one event annually that the Octopus Club runs, and that is Art Erotica. I will put the link to that event in the chat. But it's an erotic art event. It's fun. It's probably unlike most events you might go to in the community. It's edgier, more R-rated event night and adventure that we would love for folks to attend, and all money raised through Art Erotica. So it's art that's donated, and then you get to bid on the art. It's all erotic, and then you get to bid and hopefully drive up some competitive bidding, and then all of the proceeds from that event go directly to the Paul Kirby Assistance Fund. And the Paul Kirby Fund goes directly towards patients. So it doesn't cover operations costs. It goes directly into the hands of patients to cover emergency assistance needs. So we're that event, of course, the Octopus Club really it's their event that they run. We support it, of course, as well at Vivent because it goes towards our emergency assistance fund. But looking for folks who want to attend, to donate art, and to also to sponsor. So I will put the link in the chat if folks are interested and want to spread the word. Maybe Colton, we can talk a little bit about other ways to get that event promoted. Unfortunately, I know there's the Unite the Fight night or Unite the Fight event that is the same night. We had some date conflicts, and unfortunately, we just could not align on another date. So we recognize that there is another event happening, but maybe there are folks that, maybe if you can't get into Unite the Fight or have other challenges or, other interests, you might want to come to Art Erotica. The intent is to not be a direct competition with Unite the Fight. Just wanted to be clear with that. So I will put the event link in the chat and would love to see you all there.
Do you have the date off the top of your head?
Yeah, sorry, September 21st. Saturday, September 21st.
Thanks.
And I'll email you. We'll get it on the calendar.
Thanks, Colton.
Anyone have some ideas or feedback on other future events, or if webinars like this, just really trying to allow members to introduce themselves? Do you find this to be pretty helpful? Timing, content, anything anybody wants to add?
Hi, this is Allison here. I'm really appreciative of it. I've just joined the chamber. Our Lives Counseling has just opened up. We're a queer-owned counseling. We've got me as the LPC and my partner Kate in life and in business as the administrator. So Eva, I was interested in you when you spoke of the nurse practitioner. We're still needing people we can refer to for medication management and things like that. And so I'd like to, I wasn't sure which location. I found your name and I found your connection, but which location is yours?
I am at 7719 Wood Hollow. So I always say is sometimes I get to talking and you can tell I am a Midwest girl. I'm a Chicago girl and the Chicago comes out. So I say Mopac and Anderson, right? Is where we're located. I have Kelly Sue. She does telehealth and she's in office. And Dr. O is our psychiatrist. But no, that was one of the things that I noticed when I talk to patients. I'm out there, my office is right next to lobby, and I talk to patients. I'm like, hey, how are you doing today? And all questions come through me. But what is something that you say that we need that we don't have? And they're like, I'm having a hard time with medication management, trying to get medications. So give me 2 seconds, got on and hired my nurse practitioner. And I do have a doctor that we correspond with. I do have a psychologist we correspond with. But yeah, Kelly Sue's here. Send them to me, and I'll put my email and my direct line to my phone, right? Because I do all that. I see I can assist you because I always say when someone needs help, I'm on it. I don't want them to wait.
Great.
I don't want them to wait. Okay, and then I also I'm Sid. I'm loving what you're doing over there, and I have a place in Bastrop, and that's my home. And then Kate has her condo right there at Congress. Old Torf and Congress, and so we're right close to you there. And I want to look into that, and I've got some clients I'd like to send that way too, and maybe even me and Kate.
Yeah, y'all should definitely stop by. I actually am not there right now, but I am there pretty much all day, every day. So y'all feel free to stop by and check it out. I'd love for you to see it.
Awesome.
Yeah.
Sorry?
Karaoke night. You could always show up.
Yeah. Oh, yeah, we're doing karaoke on Friday. I will be performing first. So if you show up right on time, you'll get to see me. But yeah, that'll be fun. Thanks for whoever said that. I forgot that we were doing that.
Yeah, that's
Oh,
awesome.
it's Antoinette, I'm your official PR.
yeah, literally. I'm like, who's doing karaoke? That sounds fun. I'll drop my email, and y'all can feel free to email me or honestly just stop by or whatever floats your boat.
That sounds great. So fun. And then Kristen, I was very interested in your nutrition work that you're doing. I definitely have at least one client that I'd like to, this will be coming from another town. So I was glad to know that you're virtual and can see. If you're still here, I can't see you here, but thank you for that. Thanks, y'all.
Anyone else in the interest of time? Awesome.
All right. Thank you all for joining us today, and we will see you soon.
Thanks,
Bye.
y'all.
Thanks, everybody. So nice to meet you all. Thanks for having us.
Appreciate your time.
Bye.